Global COVID cases surged past 9.4 million this week, with the number of deaths surpassing 480,000. The World Health Organization expects cases to reach 10 million next week. The WHO warns that infections are accelerating and that the worst is yet to come. One of the fastest increases is happening in Brazil, where total cases surpassed 1 million this week.
The coronavirus is continuing to wreak havoc. The WHO Director General said the world saw 1 million virus infections over the past week, a sign that the spread was moving faster.
We expect to reach a total of 10 million cases within the next week. We have an urgent responsibility to do everything we can with the tools we have now to suppress transmission and save lives.
Almost half of all cases in the world originate in the Americas. The U.S. is seeing a rebound in infection numbers, and the disease is still ravaging Central and South American countries.
Many countries experiencing between 25 and 50% rise in cases over the last week, which means many countries in Central and South America and in the Americas in general are still suffering sustained community transmission.
In just 1 month, the number of infections in Latin America has increased from 690,000 to 2 million. The outbreak is especially severe in Brazil, where the total case count surpassed 1 million this week. It's the second country after the U.S. to pass the 1 million mark.
But still, Brazil is conducting fewer than 10,000 tests per 1 million inhabitants, so it's necessary for that to increase.
Experts warn that without a vaccine or treatment, the Americas could continue experiencing recurring COVID-19 outbreaks over the next 2 years.
In the absence of effective treatments or a widely available vaccine, we expect that over the next 2 years in the region of the Americas, we will experience recurring COVID-19 outbreaks, which may be interspersed with periods of limited transmission.
The WHO Director General said there are currently 220 kinds of vaccines in development across the world. He said he believed there would eventually be a vaccine to administer at large scale. Oxford University on Wednesday launched a clinical trial in South Africa, the first of its kind in Africa. Around 2,000 volunteers will be administered a vaccine candidate. They will be observed over 12 months to assess whether the vaccine candidate is effective at protecting against the disease.